when the world has got you down. And
Alzheimer's sucks. It's an equal opportunity disease that chips away at everything we hold dear. And to date, there's no cure. So until there is, we continue to fight with the most powerful tool in our arsenal, love. This is Love Conquers Alls, a real and really positive podcast that takes a deep dive into everything Alzheimer's, the good, the bad, and everything in between. And now, here's your hosts, Susie Singer-Carter and Cassie Cruz.
all you gotta do is sing a song.
Hello, I'm Susie Singer-Carter.
And I'm Cassie Cruz.
Yay, welcome to Love Conquers All.
We are so grateful that you are here with us. And we have a special guest today. Her name is Lisa Cortez, and she has worked in the medical field for over 30 years. She is an occupational therapist assistant. And Lisa works and treats patients with difficulty performing daily living and work activities due to illness or disabilities. And Lisa plays an important role in working directly with patients with Alzheimer's, providing solutions to the patients, family, and caregivers in developing a safe and supportive environment for the Alzheimer's patient. Isn't that great?
Oh my God, do tell.
And I just want to say that Lisa works in the Toledo area. So she's from Ohio, people.
Oh,
give a
good.
shout out for the Ohioans. Hi, Lisa.
Hi, Lisa. Welcome.
Thank you.
My first question before we dive in is what is the difference between an occupational therapist and an occupational therapist assistant?
Okay, so the actual therapist, when they see a patient, when a new admission comes in, they go in and do the evaluation, and then the assistant will go ahead and treat the patient based off their goals.
Got it. Okay, got it. So you're the hands-on.
Correct.
So can you explain to us what you do on a daily basis? And even though I know it's for everybody, because this is a really important area that not everybody really understands, because truly, I just started doing physical therapy myself like a year ago, and I fell in love with it. I didn't realize how much it has changed my body and how much I needed it. So could you discuss that a little bit on how that is, specifically dealing with Alzheimer's, patients or caregivers or families in that area?
So we do different things. So we do strengthening with exercise, strengthening to increase their strength to do transfers and standing, and we work on their balance. The main thing is getting them back into their activities of daily living and trying to keep them able to do their functional task on their own as long as they can. Bathing, dressing, sequencing their tasks, being able to do them without being cued. A lot of times we have to do cueing and help them sequence their tasks depending on what stage they're in.
Well, you have to explain that a little bit more. What do you mean by cueing and by sequencing their tasks?
So when I go into a patient's room, for the most part, my first part of my day is I'm assisting them getting up and getting them ready for their day. So I have to kind of guide them and tell them what to do. So I'll walk in and say, okay, Mr. So-and-so or Mrs. So-and-so, we're going to get up and get ready for breakfast. You got to kind of give them, 1-2 word directions. Because if you start going with too much, they get really distracted. They get anxious and agitated.
Overwhelmed.
And then they'll shut down. Right. Then they'll shut down. So we'll sit up to the edge of the bed. And depending on their strengths, and like I said, depends on their stage also. So if it's in early stages, it's easier. They can do a little bit more themselves. So it's not so much on me.
Right.
And if it's too much, then I have to get help. So I'll ask for a nursing assistant, or at times a physical therapy will help me too. So we'll work together, just depending on the patient's abilities. But then we'll start with their self-care, and we'll pick an outfit out, and I'll give them either 2 choices because you can't give them too many, or again, they'll get overwhelmed. So it's like, we have 2 outfits. Which one would you like to wear today? And then they'll pick one out. Or sometimes they'll say, it doesn't matter, just go ahead and pick one for me. And then we'll go into the bathroom. I tell them what to do. Okay, we're going to stand up now and hold the walker. And sometimes we got to direct them with every task. Wash your face, brushing your teeth. This is the toothbrush. Because sometimes they'll pick up something else and think it's a toothbrush and it's not.
Yep.
That's how we start the day.
I have that's amazing. That it reminds me of when my mom lived with me. She had to be cued. So if someone is in a later stage, not to like bring it all home to my situation, but I see they have the compression socks on my mom, so because she is stationary, and I always wonder what else is good.
Is she in a facility? Or
Yes,
is she
she's in a facility. Yes.
And do they offer the therapy, or is she done with that?
I think she's done with it because she's in skilled nursing areas.
But Lisa, don't they still, even if she is, especially if she's in a wheelchair or they're impacted in their movement, isn't there some type of physical activity that still needs to occur to make sure they don't get bed sores or that type of stuff?
And they should just like moving her and standing her. And I'm not sure if she's using a lift or is a person assisting her.
A person assists her when they move her into the wheelchair. If it's a guy, he'll pick her up and put her there. And of course, he loves that if it's a guy. Get her up. She's like, oh, hello.
Don't we all love that?
Hello.
Right. And some facilities have a restorative program where they will come in and do the exercises, or they'll have activities that will have a sit and be fit program, and they'll do exercises for a half an hour. And we really encourage our patients to get involved in that too, especially if they're not on therapy anymore.
Right. I mean, exercise is key.
Well, tell us about that a little bit, Lisa. So like if somebody's a caregiver and they're either at home or they're in a facility, if they're visiting with their family member that has Alzheimer's, what might be a nice activity that might be beneficial?
As long as they're not in any pain, you don't want to create any more pain than what they're in if they have any. And, there's raising their arms up and down, doing bicep curls and punch outs and bringing their arms out to the side. I mean, that's what we do is the upper body. And then there's also the physical therapy will do the lower body and have them do some marching, sitting in the wheelchair and do leg kicks.
We can have them do the can in the chair. Let's dance.
Right.
You can also get a balloon, have them tap a balloon because they're doing some dynamic sitting and they're working on their core, working on their trunk support. So that way they can sit upright, in a better position while they're eating and things like that, and doing their self-care. And like I said, it depends on the stage. And sometimes because they have a hard time following directions, you do have to do hands-on, and you're doing hand over hand, and where you're going to guide them and do the exercise pretty much for them. But then you'll be surprised. Sometimes they're going to engage in it too. Or sometimes they're going to pull away and say, I'm done. And then after a few minutes, you could start again because sometimes they won't remember what you just did.
I have a question because you always hear about, she was doing really, really well. And then she fell and broke her hip and then died. Right. And what is that? Like, why is this, the breaking of the hip often signal like the
beginning of the end?
They're older, they're hard to rebound. I'm not really, medically sure of the exact reason, but sometimes it just takes them completely out. Because they're doing really good, then they fell, and then sometimes it can just do so much to a person, especially in the elderly or depending on the disease, it just triggers it. It just exacerbates it. And I had a patient who, only 60 years old, beginning stages of Alzheimer's and dementia, and he ended up having to have a hernia surgery, and they warned the family that this could exacerbate it and that he would decline fast. And that is exactly what happened. He was doing okay before the surgery. After the surgery, he came out of it and his behaviors were so different and so enraged. And I mean, they had to exactly go back and admit him to the ER and get him admitted up to the hospital.
Was that a surgery that was absolutely necessary for him to?
And unfortunately,
continue?
It was.
Yeah. So it's like you're kind of like between a rock and a hard place. Like, what's the right decision? Because you'd have to move forward and hope that wouldn't happen, right?
I think that it's interesting for the listeners to know that if someone with Alzheimer's has a surgery, it can exacerbate the disease.
Right. And not everybody is that way, but there's that chance. There's that one person that it could happen to. And I actually seen it.
I have a question for you. On the emotional
Mhm.
side, how do you deal with that with them and their family members?
We do a lot of education. We try to help them with resources, and we get them directed to the right people to help them with whatever, they may need counseling. They may need somebody to work with them on the financial end of it, or what's next part of it, depending on the stage that they're in, and then there's patients that don't have family at all. So, luckily when they're in with therapy, and, we are big advocates for them. So, we also make sure that they're taken care of properly, and their needs are met. We inform people what they need, and if there's something going on, because we're with them every single day.
Do you become their emotional support then, and love them and give them that kind of
yeah.
energy?
Of course, we're their advocate.
They don't feel deprived of that, because that can make you not be
Right.
healthy, correct?
Oh yeah, I mean, sometimes there's patients that, they don't have any clothes. So luckily, I know where to get some, because we have people that donate, and people that have left or been discharged, and, they leave their clothes. So, it makes them feel better when they can get dressed, and you make sure that they have them, and they feel a lot better once they're all done and dressed and ready to go, versus sitting in a room by themselves in a gown.
There's so many angels. That's amazing.
She's amazing.
Yeah.
She's a great person. I know Lisa personally. I've known her for many, many years, and she's like that in life. And Lisa, this is like the perfect profession for you.
It's really beautiful.
Oh,
How wonderful
correct.
that you're giving that to the people that might not have that.
When my mom was at a different facility, the last facility she was at, there was quite a few people that didn't have family that visited. And I would go, and I got very close to a lot of the residents. And what happens is you lose some of them, and I would be heartbroken. There was an older gentleman who was 94 years old who became my boyfriend, basically, Jack.
Mm-hmm.
He was a celebrated war hero, and then became a judge for 40 years, and had a story that was remarkable, and didn't talk to anybody until I walked in. He would sit in his wheelchair with a hoodie on. And when he'd see me, he'd go, "Susie Singer Carter, I love you. Come here." And so, and he'd take his hood down. He had this beautiful white hair, right? And so every time I would see him, I'd go over to him, and he'd go, "I love you, right?" And I go, "I know you do." And he goes, I love you too. And he goes, "We're not going to have sex, are we?" I go, "No, Jack, we're not going to have sex." He goes, "Then will you scratch my back?" "Yes, I'll scratch your back."
I know.
And
those are great.
Those are the moments.
Those are great stories.
There, it was beautiful. It was beautiful.
Those are the moments that matter. Right?
Yes. Yep.
Yes. Those are the ones that get you through the day.
Yep. And when he died, I cried.
Yep.
And it was like I lost a family member. So how, as a caregiver, going day to day, how you get through that?
It's very hard, especially if we lose them. And I'm very close with one of my patients that I've been with him for 4 years. He's been in our facility for 4 years. And he heard that I was going to Bradenton, Florida. And he said, my best friend from high school lives there. Would you mind looking him up for me? So I did. And, we met at his little spot, the VFW, which was not very far from where we're staying. And, we got pictures. And then I was able to take his picture back to my patient. And I got his picture and got them both like a side-by-side frame so they can look at each other. Because my patient's like, I'll never see him again.
Oh my God, this is so beautiful.
Wow, Lisa, that is such a beautiful story that you were able to fulfill his request to be connected again.
Mm-hmm.
And because of you, he was able to do that. So when you came back home, tell us what that meant to him.
Oh, he was very grateful. He hugged me, of course, and said, "Thank you. And, let me know when you go back, and I'll call him." And
we need more people like you, though, Lisa, because honestly, there are a lot of people, like you said, don't have family. They don't, and for you, I mean, I'm just so touched that you would bring clothes to people that don't have clothes. And I mean, so what the message to me is, like, people that are listening and you have a family member in an assisted living, and maybe you live on the other side of the country, make sure that someone is advocating for your family member or your friend that you love. And hopefully you can connect with someone as lovely as Lisa, and who will help advocate for them, because obviously we can't always be right there for our family members and or loved ones. So,
and I want to ask Lisa a question.
Yes.
Lisa, how do you deal emotionally with what you have to after you've caregived all day for all those people and you see all different types and that energy? What do you do to clear yourself and to make sure you take care of yourself so
that's
you're
a great
you're
question.
recharged?
Well, I exercise. That's what really helps me. And I run. So I try to at least run 3 days a week if I can. Just depending on how my day is at work, long days. But that's what I do. I exercise, eat right, and just take care of myself. So that way I can keep going.
Good shopping is always helpful.
Shopping is good.
Oh yeah, everybody loves to shop except me.
I'm sorry.
The worst therapy ever. Please don't do it. That's torture. I like having nice things. I just don't like going to get them.
Oh my God, it's
Right.
it's like it's such a drug of choice. What is that wrong? Is it wrong?
No, I like shopping too.
Thank you, Lisa. When I'm in Ohio, you and me's, we're going. Okay.
Okay,
You know what I'm
sounds
talking
good.
about, right?
Sounds good. Yep.
Lisa, will you share some other stories about the people that you are caring for? Maybe they weren't so great. Maybe they were really rough for you. Because I think that the rough things and the ugly things need to be discussed so we know that, yes, we might do our best.
Right.
So there's a particular patient that I work with too that has Alzheimer's dementia, and it depends on her behaviors or her moods, because sometimes their behaviors fluctuate and they're very irritable, or it's just not good time. They're very agitated. So she'll say, I don't want any help. I don't want you here. You just need to leave. You just need to go. Sometimes as soon as they hear that word therapy, they want no part of it. We have some that love us, but then there's some that don't at all. What I do is I will go out, go see somebody else, come back in. And so that whole situation that we just had was de-escalated. And then maybe she'll start working with me again.
That's such great advice.
Yep.
You're redirecting by restarting that whole thing.
Correct.
For that second, it wasn't ready. And then when you come back,
No.
yeah, that's super important.
I just tell her, I just tell them, okay, this isn't a good time. I'll check on you a little bit later. I hope you feel better, get some rest, and I'll come back. And that's what I do. Sometimes it might be till, a little bit later just to give them that time. But that's kind of how you have to handle those situations.
Totally. And sometimes you can return and they go, where have you been?
Right.
I've been waiting.
Right.
Well, I was just here, but
Yeah.
I'm not gonna regurgitate that one.
No. My
Right.
my mom's caregiver, who used to be my daughter's nanny, so she's part of our family, right? And so she would come to clean my mom's home, right? And this is when my mom had Alzheimer's. So she would come and it would be on her time that she'd be there. She'd knock on the door and my mom would say, what are you doing here? You're already here yesterday. Go home. You can't, what are you trying to make more money? Go. Bye. And I didn't know this till years later. Erlonda told me this. Erlonda would wait 5 minutes, ring the doorbell again, and my mom would open and go, Erlonda, come in for some coffee. Where were you been?
Right.
I missed you.
Right.
Hey, that's the reality though. And that's the thing that I think that all of us need to really dial in on. Like, listen, people that have Alzheimer's, they have a memory loss. So, sometimes it's not you. Why fight them at that moment? Let them have that reality.
Yeah.
Whatever their reality is at that moment. If you go with their flow and where they're at that moment, it's going to be a lot easier for the people that do have the memory.
You just have to lean into where they're at. And I think right. Being a family member is different than being someone who is not as attached or doesn't have a history, because, it can be very jolting when someone that's you grew up with, who's raised you, calls you a whore, or,
Right.
Or doesn't know who you are anymore.
Doesn't know who you are. You can,
and then you want to try to go, no, it's me.
Yeah.
And you try to force their memory. I think they get more agitated. Would you agree, Lisa?
Sure.
Right. And a lot of times what I'll do is I'll check with the nurse when I've walked out. It's like, so-and-so seems very agitated. Did they get their medication? Are they due? What would be a good time to come back? And, I'll check with them also, because maybe they didn't get their medication yet. So sometimes that's plays into it too.
Lisa, I have a question. Speaking of medication, my mom was put on a drug called Depakote for a while, which was responsible for her being in a wheelchair for the rest of her life because,
What?
yeah, what happened was my mom was going to a doctor's appointment when she lived at her facility before the Jewish home, and she was agitated, and which is one of the reasons why I want to do this podcast and why it's so important. People need to be more aware of what Alzheimer's looks like, how it manifests, because when my mom was agitated, they got to the hospital and they assumed that she was having a mental breakdown and put her in lockup.
Oh no.
I mean, that does happen.
I mean, I want, and we need to talk about this, especially like someone
very important,
because my mother, I didn't know this till later. When I found out she was there, we couldn't get her released right away. That's a whole nother story. It takes, because it's all bureaucratic. You have to be there 72 hours, and then the admitting doctor has to be the one to release her, and he left for the weekend. Right. So on and so forth. When I got there to visit her, she was in a chair tethered. And I asked, why is my mother tethered? They said, because she falls. She's not mobile. I said, what are you talking about? She walks 5 miles a day. She's absolutely mobile.
Yeah.
And then later, when her primary doctor called me and said, your mom's been on Depakote for about 3 months now.
What is Depakote? What is that?
It's a tranquilizer that they use on, psychotic patients.
Oh my goodness.
And what it does is it enables them to be, I call it the zombie pill.
Okay.
It's like the lights are on and nobody's home.
Right. They basically rendered her useless. Okay.
Yes. And my mom became a zombie. And I actually thought it had to do with the disease and that the disease had progressed.
Gosh.
And then her doctor finally called me and says, it's a black label drug for people with dementia, meaning that it can cause them to have premature death. He said, do you want me to take her off of it? I said, yes. I mean, is there a question?
Absolutely.
Do you know that it was like a whole new person, but she now talked again. She was happy. She wasn't talking at all. But she never got out of the wheelchair.
Oh my goodness. I'm so sorry. That's rough.
Thank you.
That's a rough place, because you want to think that the, health professionals are making the right decision. And I cannot believe that you were not part of that decision.
No, I was not.
That just blows my mind. How could a family member not be part of certain decisions? It's unconscionable to me.
No. And thank God for the doctor who made me aware of Depakote.
Be careful, everyone, about that drug.
Depakote, get your parents off of it unless they're hurting themselves. There's other ways to handle it better than that drug.
And we address those issues too. I mean, we talk to nursing, we go through the whole team and let everybody know, okay, this is what's happening to this person. We're not really sure if it's medication or what's going on. So that way they can, all the department heads, they go to a meeting, they address these issues, and they go back out on the floor and they see what's going on.
So that's important, everybody.
Make sure you know what drugs your parents.
But also get to know if your mom or dad or a family member, brother, sister, whatever, has Alzheimer's, dementia, and they're working with someone in the occupational therapy, department. Talk to them. They're the ones that have hands-on with your loved one. Get to know them.
Smart.
Take them out to dinner. Give them gifts, massages. Gifts are good, right, Lisa?
No, we're not allowed to accept them. No.
So don't give them gifts. Just bring them nice, beautiful, loving energy.
Yes,
that's the gift. That's the gift that we can all give each other, and that's hopefully what we're bringing to all of our listeners and you and us. And we want to bring love. Our intention is to, and basically. Information is power, and we want to bring information so we can actually help alleviate stress if we can, and just learn how to deal with this and wrangle this better. At least I have a question for you. How do you deal with the caregivers who are coming in, and how do you address them?
We tell them about the progress and how things are going. And if we, need something to help them, sometimes we try to make them more feel at home and comfortable, bring them something in that belongs to them that they can connect to. That way, if they're having some behavioral episodes, they have something to
anchor them back to their
favorite blanket or a picture or something. that helps, like just to connect them, like, okay, this is my place, my spot, my area. A lot of times I'll treat them right in their rooms because they're real familiar there. And it's, you get them out of the room, or if I take them into the therapy room, it's just so overwhelming for them. They shut down and they won't do anything. So we'll go back to their room and just do things there. You just every person's different, and you got to treat every person what works best for them.
So do the family members, the family members interact with you on a consistent basis?
Oh, yeah.
And are they directing you in any way, or are you,
if they have a
educating
concern,
them?
A lot of times if they have concerns, this didn't happen or that didn't happen, I'll go find out what, check with the nurse. I'll check with the social worker. We advocate for them. We'll go get to the source, so that way they're feeling at ease and they're feeling better about their family member. Safety is a big issue too. Making sure everybody's making the patient safe when they're in our facility. So
Right.
And making sure you're safe as well.
You mean like getting punched and things like that?
Yeah, exactly. And not on purpose. It's just that
I know.
but they won't remember that. It's not like they're doing. I know that it sometimes seems like it's on purpose.
Right.
So
when I work over at the one facility that's completely Alzheimer's dementia, there's a certain time of the day, 4 or 5 o'clock. It's called sundowners, and things start happening. And patients will stand up and to try to walk and, by themselves, and they really should not. So you try to de-escalate the situation. Okay, let's go for a walk, and you take, you work with that. Or it's time to sit down. Let's sit down and, let's get a snack, or you just redirect so that way they stay safe.
Right. And I've seen residents who get physical, just come up like, I had a friend of mine, a guy friend who was visiting with my mom, and this one woman, I think she was trying to flirt with him, and he wasn't responding the way she wanted to. So she kept going up and smacking him on the back of the head. Right.
Yeah.
And
yes, that can happen.
Yeah. And so I'm sure you guys as therapists have to deal with that. And, and
what do you do? What do you do when that happens?
When they start getting physical?
Yeah.
A lot of, sometimes you'll take them back to their room where they're feeling safe. Or if they're in their room, you have to let the nurse know, and you have to make sure they're safe. But then I would come back, a little bit later once they feel like, they're not as agitated or being so irritable.
Wow. Yeah, de-escalation at all times.
Mm-hmm.
You're not going to talk them out of it. You can't.
And redirection, because they're not going to know what is happening at that time, right?
Right.
They're not,
right.
Even though it seems and appears like they do, and that they're in charge of their faculties.
The biggest thing is making sure they're safe. Making sure they're safe and calm. Get them generally emotionally distressing, and you get the nurse, you get everybody kind of involved, so that way they're going to be okay.
Because it's a lot for everybody. It is all different sides. And really, how do we start talking about it and communicating? What does this look like? And how can we really love through that? Because it's hard. When somebody's punching you, it's hard to say, I love you. It's difficult.
Well, it's hard to not take it personally. And I think we need
Right. That's the key factor. You have to understand what they're going through. It's the disease. It's the process. It's not them anymore. And this is just what's happening to them.
Right.
And they're scared, and they're scared as well. And that's usually why people are agitated or reacting that way, because they're in a lot of fear themselves about what is going on. I don't know where I'm at.
Exactly.
A lot of time they want to go home. They want to go home. That's all they say. They want to go home.
Lisa, that's a great topic. We need to have that topic about wanting to go home, because that is a chant that you hear all the time. And I used to hear it when my mom lived with me. Okay, see you later. I'm going home. And you'd say, you're home. No, I don't think so. Right. And it becomes,
but we usually say, maybe tomorrow, we'll have to talk to your daughter, or we'll have to talk to your son, but maybe tomorrow, or, we just try not to make it sound like you're never going home. Because they don't understand that.
They don't. Sometimes you can play along with it. Like, I know there's a few facilities now that are these kind of experimental facilities, almost like contained cities, where you go, let's go to the bus. We're going to pick up a bus to go home. And by the time you go to the bus stop and you get to talking with them, they calm down and they forget that they wanted to go home.
Right.
So that's
all the nice little things to learn.
yes. Lisa, thank you so much.
You're welcome.
And we really appreciate you for what you do and others that are like you. And it makes my heart so much fuller to know that there are people like you that take care of the people that we love.
You're an incredible human being, Lisa.
Yeah, I second that emotion.
I'm grateful for, you sharing your expertise and your stories with us and your experience. And of course, we thank you, our listeners, and we hope you liked our show. And if you did, please subscribe and share the podcast with others who are also dealing with Alzheimer's. And we have so many incredible guests lined up again, more and more, and hoping that we are inspiring you and informing you.
And send us comments and suggestions for topics. If there's things that you want to know more about, we're there for you. We'll get somebody that knows, and we'll figure it out. So you can message us on anywhere on all of the social medias. Love conquers all. And
remember, love is powerful, love is contagious, and love conquers all.
Bye-bye.
Bye.
Bye.